Okay, picture this. Inside an animal, there's a full-on microscopic war happening. An invading army of bacteria is just multiplying like crazy, building new soldiers, new weapons, every single second. But what if we could send in secret agents, saboteurs designed to sneak in and shut down their entire production line from the inside? Well, that's exactly what we're going to talk about today. Let's dive into the world of these amazing veterinary antibiotics. So, here's the million-dollar question, right? It's the whole basis of antimicrobial therapy. How do you wipe out the bad guys without causing a bunch of friendly fire and hurting the patient? Well, the answer is all about exploiting a key difference between their cells and our patient's cells. It's a brilliant strategy called selective toxicity. And the best way to pull that off? You go straight for the heart of their entire operation, their protein factories. See, without proteins, bacteria can't build anything. They can't function, and they sure can't multiply. It is, quite literally, game over. And that factory has a name. It's the 70S ribosome. Now, here is the absolute key to everything. The bacterial ribosome is fundamentally different from the ribosomes in animal cells. And that difference, that's our secret weapon. It lets our antibiotic saboteurs recognize and attack only the bacterial factories, leaving the animal's own cells totally untouched. Pretty cool, right? Now, our saboteurs are specialists. They're not just going to go in and start breaking things randomly. No, they go for specific, critical weak points. You see, this whole bacterial factory is really built in two main parts, and we have drugs specifically designed to hit each one. The easiest way to think about it is like this. The 30S subunit, that's the little machine. It's like the quality control inspector, the one reading the blueprints. Then you've got the 50S subunit, the big machine. That's the master builder, actually putting all the pieces together. So you can see, if you disrupt either one of them, the whole production line just grinds to a halt. So let's start with the agents that go after that smaller machine. First up, the 30S subunit, the part that reads the blueprints. Our first group of saboteurs are precision agents, and they are designed to take this piece of the factory down. There are two major families that work here. Both are absolute heavy hitters, but, and this is important, they have very different ways of getting the job done. So on this slide, you can really see the two different strategies. First, we've got the aminoglycosides, drugs like gentamicin and amikacin. These guys are what I call the chaos agents. They latch onto that 30S subunit and make it misread the genetic code. The factory starts churning out completely useless, garbled, toxic junk proteins that actually poison and kill the bacterium from the inside. That's why we call them bactericidal. Then, on the other side, you've got the tetracyclines, like doxycycline. They're more like a roadblock. They bind to the exact same subunit, but they just stop the line. They physically block new parts from being added. The bacteria can't grow or multiply, which gives the animal's immune system the time it needs to come in and clean up the mess. And that's why they're bacteriostatic. Now, for aminoglycosides, there are a couple of things you just have to remember. They hit hard and they hit fast. Their killing power is concentration dependent, which means the higher the dose you can get to the site of infection, the faster and better they work. But, and this is a huge but, they have a critical weakness. They need oxygen to get into the bacterial cell in the first place. That means they are completely useless against anaerobic bacteria. The kind that love to live deep inside wounds or abscesses where there's no oxygen around. Tetracyclines, on the other hand, are just incredibly versatile. Their spectrum is massive. They can handle a huge range of common bacteria, sure, but their real claim to fame? Their power against those weird intracellular invaders. Bugs like rickettsia that causes Rocky Mountain spotted fever or even chlamydia. These are the tricky ones that a lot of other antibiotics just completely miss. All right, so we've covered how to sabotage the blueprint reader. Now let's move on and look at the agents that go after the big machine itself, the 50S subunit. The one that's actually assembling the proteins. Yeah, this quote right here really gets to the heart of it. We've got a few different classes of drugs that all target this big subunit, but they all bind to pretty much the same spot. And what does that mean? It means they compete with each other. You really can't use them together, because they just get in each other's way. That's a super important point to remember in practice. So let's meet the crew. You've got the macrolides, like tylosin, which is a big one in livestock, the lincosamides, like clindamycin, which you see all the time for dogs and cats, and the phenocols like florfenicol. Now, chemically, they're all different, but their game plan is the same. Bind to that 50S subunit and just stop it from adding new links to the protein chain. So just like the tetracyclines, their main effect is bacteriostatic. They jam up the factory instead of blowing it up. Okay, so far, these drugs sound pretty perfect, don't they? But sabotage is a messy business, and these incredibly powerful agents can cause some serious collateral damage. Knowing the risks is every bit as important as knowing how they work. For aminoglycosides, that awesome killing power comes at a price, and that price is a really high risk of toxicity. They tend to accumulate in the cells of the kidneys and the inner ear, and they can cause damage that is irreversible. Cats, you should know, are especially sensitive to the vestibular toxicity, the kind that messes with their balance. And you would absolutely avoid them in working animals, like guide dogs, where their hearing is so essential. Tetracyclines have a really unique and very well-known side effect. They absolutely love to bind to calcium. So in young growing animals, this means the drug literally gets built into their developing bones and teeth. And what does that do? It causes that classic yellow or brown staining that's permanent. It's also really important to know that in horses, they can cause a severe, sometimes even fatal colitis. And speaking of fatal, this is a warning that you just cannot overstate. Lincosamides like clindamycin are absolutely 100% contraindicated in horses, rabbits, guinea pigs, and other herbivores. They just wreak havoc on the delicate gut flora that these animals need to digest their food. It leads to this catastrophic overgrowth of toxic bacteria that is very often lethal. This one is a major public health red line. Chloramphenicol is a fantastic antibiotic, no doubt, but it has a rare and absolutely devastating side effect in humans. It can cause something called aplastic anemia, which is a complete shutdown of the bone marrow. It's fatal. So to prevent any possible chance of it getting into the human food supply, its use is strictly banned in any food-producing animal, period. So let's just quickly recap these critical warnings. For aminoglycosides, I want you to think kidneys and ears. For tetracyclines, teeth and bone staining in young animals. For lincosamides, remember that lethal GI upset in herbivores. For phenocols, it's that bone marrow suppression in humans, which is why it's banned in food animals. And finally, some macrolides, a drug called tilmacosin is the classic example, carry a really severe risk of cardiac toxicity, especially if it's accidentally injected into humans, pigs, or horses. You knew this was coming. For every clever act of sabotage we come up with, the enemy adapts. And right now, the single greatest threat to all of these incredible drugs is the evolution of bacterial resistance. It's really just simple, natural selection at work. Every time we use an antibiotic, we kill off all the susceptible bacteria. But if there are any in that population that have some random mutation that lets them survive, well, they get left behind to multiply. We are, in effect, selectively breeding for superbugs every single time we use these drugs. So how do they do it? Well, bacteria have developed three main counter-sabotage strategies. First, they can install these things called efflux pumps. They're like tiny little revolving doors that just spit the antibiotic right back out as soon as it gets in. Second, they can produce enzymes that literally find the antibiotic molecule and chop it to pieces, neutralizing it. And third, and this one is really clever, they can alter the target itself. They change the shape of their ribosome just enough so our saboteur doesn't even recognize it anymore and can't bind on. So let's just put it all together real quick. Our saboteurs, these antibiotics, they infiltrate the bacterial protein factory, the 70S ribosome. The 30S inhibitors either cause total chaos, like the aminoglycosides, or they create a roadblock, like the tetracyclines. Meanwhile, the 50S inhibitors, the macrolides, lincosamides, and phenocols, are all competing for the same spot to jam up the works. And as we've seen, every single one of these powerful drugs carries some serious risks that we absolutely have to respect. And that really leaves us with the most important question of all. These drugs, they are miracles of modern medicine, but they are a finite resource. As bacteria continue to evolve defenses against our very best saboteurs, we have to stop and ask ourselves, are we using our best tools wisely enough? Are we doing enough to preserve their power?